Así que, Doctor.
Thank you, Governor. Good afternoon, everyone. I'll get right to the medical update. Since yesterday, we are reporting 1,545 additional individuals with COVID-19. We now have 98,030 total cases in the state of Illinois. Unfortunately, this does include 146 additional people with COVID-19 who have been reported to have died in the last 24 hours, for a total of 4,379 fatalities. A total of 621,684 total tests have been run in the state of Illinois, with 18,443 tests reported in the last 24 hours. We have a positivity rate of 8% for the last 24 hours. As of last night, 4,002 individuals were in the hospital with COVID-19, and of those, 993 patients were in the ICU and 576 patients were on ventilators. There is evidence that the stay-at-home plans are working. I know people are asking, but why are there so many cases and why are people continuing to die? But we know that the number of cases is a big function of how many tests we're doing. And we know that the deaths would have been significantly increased if we had not implemented a stay-at-home order. We could have been seeing tens of thousands of deaths. So as we move to reopen, we must do it safely and deliberately. The decision to change our daily lives was not made lightly. I'm very thankful to Governor Pritzker for firmly deciding to protect all Illinoisans by enacting the stay-at-home order back in March. If he did not commit to our safety so early on, Illinois would not be ready to be advancing to the next phases of our Restore Illinois plan. Hear me clearly, the virus is still out there. So staying at home whenever you can and keeping your distance from other people is still the way to stop and minimize the spread. Picture, if you will, dominoes lined up. If you knock over the first dominoes and the other dominoes are closely behind it, the rest will fall in succession. However, if you take some of those dominoes out of the line or you space them further apart and then knock over the first domino, the rest of the line does not fall because there isn't another domino to contact. So think of that as some of the dominoes stayed at home. Or if the next domino is too far away to be knocked over, think of that as social distancing. We must continue to follow the data, which will help inform how we continue to move forward and get to our new normal. We can't undo all that we've done. We are going forward. We want to get into phase 3 and then beyond. We will be all in for Illinois. We will continue to stay home, wear our masks, wash our hands, and clean frequently touched surfaces. Let's do this together. And with that, I will translate comments into Spanish. Buenas tardes. Voy a empezar con el reporte médico de hoy. Desde ayer estamos reportando 1,545 individuos adicionales con COVID-19. Ahora tenemos 98,030 casos totales confirmados en Illinois. Desafortunadamente, esto incluye 146 personas adicionales con COVID-19 que han muerto, para un total de 4,379 muertes. 18,443 pruebas hechas fueron reportadas en las últimas 24 horas. 8% de esas pruebas fue positivas. Hasta anoche se informó que 4,002 personas en Illinois fueron hospitalizadas y de ellos 993 personas estaban en la unidad de cuidados intensivos y 576 personas estaban en ventiladores. Hay evidencia que el orden de quedarse en casa está funcionando. Es la verdad que todavía estamos viendo casos y desafortunadamente la gente sigue muriendo. Pero imagine que la cantidad de casos y muertes Si no hubiéramos implementado una orden de quedarse en casa, veremos cientos, muchos más casos y muchos miles de muertes. A medida que avanzamos para reabrir, debemos hacerlo de manera segura y deliberada. La decisión de cambiar nuestras vidas no era fácil. Agradezco al gobernador Pritzker por haber decidido firmemente proteger a toda la gente de Illinois por la orden Stay at Home en marzo. Si no se comprometió con nuestra seguridad tan pronto, Illinois no estaría listo para pasar a la fase 3 del plan Restaurar Illinois en unos días. Por favor, escúchame. El virus todavía está presente en nuestras comunidades. Quedando en casa cuando puedan y practicando distanciamiento físico continuará ayudando a detener la propagación de este virus. Imagine fichas de dominó alineadas. Si tumbas el primer dominó, el resto caerá. Sin embargo, si saca una o dos fichas de dominó de la línea, o si las espacia más y tira la primera ficha, el resto de la línea no caerá, porque no hay un dominó para caer. Por favor, debemos continuar siguiendo los datos, lo que ayudará a informar cómo avanzamos y cómo podría ser la nueva normalidad. No deshaga todo lo que hemos hecho y corra el riesgo de regresar. Por favor, hablan con su familia, sus amigos, sus vecinos, sus comunidades sobre la importancia de seguir adelante en nuestra lucha contra COVID-19. Muchísimas gracias. And with that, I'll turn it back over to Governor Pritzker.
Thank you very much, Dr. Ezike. I want to begin my portion of today's briefing with some, frankly, very exciting news. Over the last few weeks, we've seen Illinois make significant measurable progress, and I've been reporting on it to you, in growing our daily testing numbers. And today, we reached another major milestone. Among the most populous states in the United States, Illinois has now overtaken New York to become the #1 state in the nation for testing per capita over the past 7 days. There's much more work to do to advance testing to make it even more widely available, but I do want to recognize at this juncture the folks who made this happen. Of course, IDPH and its lab professionals who are working day and night to process the tests that are given to them. Our raw materials procurement teams, our in-state research university partners, our partner hospitals, health centers, and clinics who are administering the swabs and tests, commercial laboratories, the Illinois National Guard, and of course, the countless healthcare workers doing the patient care right there on the ground. And I'll take this moment to remind everyone who can get a free test at any of our COVID testing locations. Anyone who has COVID-19 symptoms, a cough, shortness of breath, a fever, for example. Anyone who has a risk factor, such as a contact with someone confirmed to have COVID-19, or a compromised immune system, or a serious chronic medical condition. Anyone who works in a healthcare facility. Anyone who works in correctional facilities such as jails or prisons, anyone who works as a government employee at any level of government, anyone who serves as a first responder such as a paramedic or emergency medical technician, a law enforcement officer or a firefighter, anyone who supports critical infrastructure such as workers in grocery stores and pharmacies and restaurants and gas stations and public utilities, factories, childcare, and sanitation. As testing expands, so too will the criteria allowing more people to get a test. A full list of our more than 250 public testing sites is available on our website at coronavirus.illinois.gov. I also want to update you by letting you know that all 4 regions of the state of Illinois remain on track to meet the metrics to move into phase 3 of Restore Illinois. That's terrific news. Phase 2 of the plan began 18 days ago on May 1st with the reopening of state parks, golf and other outdoor recreation facilities, the opening of garden centers, pickup shopping options at retail stores, the beginning of schools allowing students back in to retrieve personal belongings, and some additional sectors of manufacturing returning to work. And of course, it's been in phase 2 that non-emergency surgeries restarted, which included everything from biopsies to chronic pain procedures to orthopedic surgeries. These reopenings happened for all of Illinois over 2 weeks ago, and they're only now coming to some other states, like in New York, in New Jersey, and California, where curbside pickup at retailers only became available in just the last few days, or golf in Massachusetts, which opened about a week after Illinois. I know that monitoring the various measurements, rules, and regulations across the United States is hard to do, especially if you live in a border city and you see a lower level of precaution just down the road. Believe me, I wish there wasn't such a patchwork of different requirements from state to state. There should have been a national plan. In fact, there was real potential for one. In mid-April, the president unveiled the White House guidance for reopening with explicit public health factors weighed in the mix. Under the president's own plan, Illinois would not reach the next phase until after our current Illinois plan has begun phase 3. But President Trump decided to inject politics in where science and data should have won out, leaving the states to create the patchwork that exists today. Some states have chosen not to listen to the advice of medical experts. There are even politicians in Illinois who ignore science and instead are playing to a small minority who protest at our state capitol. Most of the states with the largest economies have chosen to listen to the science and analyze the data and act according to what will restart jobs and businesses safely. I can say with confidence that here in Illinois, we've committed to operating with a focus on public health and transparent, measurable benchmarks to move to each new phase. For those interested in seeing the data and the metrics, they're updated each afternoon and posted online at dph.illinois.gov/restore. Joining us today are two experts in infectious disease control to provide their perspectives. Dr. Richard Novak, head of the Division of Infectious Diseases at the University of Illinois Health System, and Dr. Emily Landon, the Executive Medical Director for Infection Prevention and Control at University of Chicago Medicine, who first joined us in March and inspired so many Illinoisans to help keep each other safe. These two doctors have graciously offered their time to update you on the battle against COVID-19, which is still very much alive in the halls of our hospitals and among the population at large. Before I turn the mic over to them, I want to say that I know there are some of our fellow Illinoisans who feel that their lives didn't change much between phase 1 and phase 2, and we're all itching to move ahead. So why can't we just do it now? Well, there's no doubt this is hard, but public health means that each of us is working to protect all of us. It's about our collective impact on each other. And because many Illinoisans are engaged with the reopenings that have occurred in phase 2, it's critical that we observe the full 28-day measurement period before moving forward to phase 3. The good news is that we're just 10 days from that point. And as of now, all 4 regions of Illinois are on track and moving forward into phase 3 before the end of May. As residents, businesses, and employees gear up for phase 3, we will be providing specific safety and mitigation guidelines for workplaces and activities that are reopening. These guidelines have been in development with business owners, employee representatives, and industry associations, including many women and minority-owned operations. And I look forward to sharing more information about that in the coming days. Until then, I'm delighted to hand this conversation over to Dr. Emily Landon, Executive Medical Director for Infection Prevention and Control at University of Chicago Medicine. Doctor?
Thank you, Governor Pritzker, for inviting me to join you today. First of all, I want to thank all of you Illinoisans for being sensible, cautious, and selfless in the way that you've approached this pandemic. Some of you have been sick. Some of you have lost loved ones, and many of you have lost jobs. But I know a lot of you will also look back on this and wonder why we had to stay at home since nothing awful happened. But like I said in March, this exactly is the mark of success. It's what a flat curve looks like. It's not perfect. Still, every person with COVID passes it along to someone else who will get COVID. That means our case counts and hospital loads stay stable and somewhat predictable. We would love even less transmission, but this virus is tricky. And even keeping things flat has required huge sacrifices. Now we all realize there will be no swift rescue, no knight in shining armor in the form of a vaccine or an antiviral that will sweep in and return our lives to normal before the summer comes. I'm pretty disappointed about not looking forward to sitting by a pool or going to block parties and taking a vacation. But we need to begin to revive some of our workplaces. And it's not without risk that we do this. Our transmission balance is tenuous, and business as usual could set off another wave of infections that threaten our lives and our livelihoods. We need masks, we need hand hygiene, and we need distance to make this work. And we do need to be all in order to be successful. These cloth masks, like the one I have here, are our lifeline. As you know, people can spread COVID for days before they get sick, or some people may never get symptoms at all, which means that anyone could be contagious with COVID at any time. And these cloth masks don't just help protect you from other people who may be sick, which it turns out some new evidence shows they may be better than we thought they were, which is great news. But they also help to keep your own respiratory droplets inside the mask so that you can't get them onto grocery store boxes or ATM screens. But they're not perfect, and you can't wear them when you're eating and drinking. And that means we have to pair them with keeping our distance and staying home when we can, and keeping our hands clean in order to maintain that tenuous transmission balance that we have. So please, never leave the house without your face covering. And always put it on when you go inside another building or if you're near other people outside. Soon, I promise, it will be as natural as wearing pants, which most of us are pretty good about. I still see a lot of people, though, that don't have face coverings on outside. And it makes me wonder if we're going to be as successful in this next phase as we have been in March and April. I think we can do it. This is a fight against a virus, not an ideology. And I know many of you understand that. A lot of you, almost all of you. And you will take my message to heart. And you'll lead your families, your communities, your neighborhoods in wearing your masks, in staying home when you don't need to be out, in order to make space for essential workers, to be able to get to their essential jobs, and for other people to do important tasks. And when you do go out, you'll wear your mask proudly, because it says to others that you're not giving up, and you're not giving in, because you're in this fight to win.
Thank you very much, Dr. Landon. Terrific, and just a message that I know people will take to heart. So very much appreciate your time and willingness to share. I next would like to introduce Dr. Richard Novak, the head of the Division of Infectious Diseases at the University of Illinois Health System. Dr. Novak?
Thank you very much, Governor. I'm very pleased to participate in this conference today to give you both clinical and research perspectives on facing the challenge of the COVID-19 pandemic. Illinois is meeting its goals of expanding the availability and numbers of COVID-19 tests, and the percentage of positive tests is steadily declining, as you pointed out earlier. In the hospital setting, this is reflected by a slow but measurable decline in new hospitalizations and fewer patients in intensive care, as we're seeing at the University of Illinois. The flattening of the curve has prevented the healthcare system from being overwhelmed, and the death rate per capita here in Illinois was much lower than in other states like New York, despite the number of cases that we've seen. This is all a result of these careful measures that we've been taking. We're now receiving shipments of the drug remdesivir, which has been proven to be effective at reducing the severity of the illness, and particularly if it's given before the severity of the illness gets worse. We're not done with this, however. We've launched next phase study combining both remdesivir with a second drug called baricitinib in hopes of further improving on the outcomes of people that we treat. By all measures, it appears we're making slow but steady progress in controlling the pandemic here in Illinois. This has been through careful examination of and response to the data. I know people are tired of wearing masks and social distancing, as Dr. Landon pointed out. You may ask, why do we still have to do this? Masks are very effective at capturing the droplets with virus in them. Surgical masks are maybe a little bit more effective than the homemade mask, but they both work. We call this source control. You're the source, and your droplets are being captured in your mask. South Korea was able to very rapidly control their local epidemic by universal masking, social distancing, and large-scale testing, just as we're doing here, and we're seeing the effect of those measures. As society begins to open up in the coming weeks, we'll need to continue practicing social distancing and wearing masks. I really like the analogy that Dr. Ezike did with the dominoes. We do these things because it protects those around us. We're all in this together, and I wear a mask so that I won't spread the virus to you. You then won't spread it to your family and friends. In turn, I hope that you will do the same for me, and eventually this pandemic will fade to the point where we won't need to do it anymore. We're not there yet. Lastly, the search for new treatments and prevention strategies is moving in an unprecedented rate. Vaccine trials will be starting this summer here in Illinois and elsewhere. I encourage everyone to volunteer and participate in these important studies. The whole world is waiting for the results of these trials. I'm going to don my mask and turn it back over to you, Governor. Go Cubbies.
Go Cubbies. There you go. Go Cubbies. Terrific. Thank you very much, Dr. Novak. And now I'd be happy to take any questions from members of the media, and perhaps the doctors who've joined us might be willing to take questions as well.
We're going to start with online questions today, and then we'll move to our pool reporters, and we'll try to keep it tight here and even between all three of us. So we will start with Christine Herman at NPR. Can Dr. Ezike please elaborate on what exactly it means that phase 3 will allow limited childcare and summer programs open with IDPH approved safety guidance? Has that guidance been made available yet?
Yeah, so we will have more information to come before the end of the week, but we know there are childcare establishments that are already open now. And we will continue to make that available as more and more people will be returning to work. So obviously that need is pressing, and more pressing as people are getting ready to return to work. So we will lay out that guidance in just a few days, and we will have more childcare opportunities to address the needs of the communities as they start returning to work.
Jerry Nowicki at Capital News, Illinois. The hospitalization numbers all appear to be the lowest since you began reporting daily data on April 12th by a considerable amount. Should we take anything from this, or are we still expecting more volatility in those metrics?
I think I'd like to call on any one of the three doctors, honestly, to answer that question, but perhaps we'll start with Dr. Ezike, and please chime in, anybody else.
Yeah. So I get it is great news, and I'm glad that you noticed that to fall under the 4,000 for the number of people hospitalized. So obviously it's a continuum. People get infected, then they get sick, then if they get hospitalized, then the ICUs and maybe pass on. So it is a good sign that there's fewer people in the hospital, but we have to remember that things are going to start changing. And so we will continue to follow these numbers. And it's why that we need a hard reset and can't just jump from phase 2 to phase 4, because with each phase, we've made changes and loosening things up. And so we want to make sure that these new things that are coming on board, that they are not resulting in another new acute spike or increase. And so that's why we will continue to watch closely, and over the next phase, another 28 days, make sure that these measures that have loosened don't have a spike that will make us want to tamp the brakes a little bit. So we'll be watching that closely. But yes, this is good news. This just solidifies these measures have been working, both the stay at home, both the masking, both the social distancing, all of those things are effective. And that's why we've got numbers that are improving.
If you don't mind, I just want to, Dr. Ezike obviously has said everything important that there is to say about this, but I would just add that the volatility in these numbers is up to us. It's whatever we make it, with the way that we take on and adapt to the changes that we have to make in order to accommodate this virus in our daily lives. So I hope, and I know Illinois can do it.
Hannah, the Daily Line. Governor, lawmakers will return to Springfield this week and vote on a budget based on revenue estimates from Gombe and COGFA that are now about a month old. Are there updated revenue estimates available from your office, and are you asking lawmakers for a lump sum budget in order to make cuts and spending decisions yourself? If so, what can be cut?
The answer to the latter question is no. The answer to the former question is that there have been some adjustments, not major revenue adjustments, but as I mentioned the other day, there's additional spending required related to Medicaid. Now, we believe that that some of the federal funding that will come will alleviate a little bit of that, but to be honest with you, we're including it in the budget because we don't know. And so that additional spending will have to be in the budget, and therefore, we're going to have to make room for it because we have to cover healthcare, especially for COVID.
Chris Carter, WAND News in Decatur. Several malls and businesses are set to open next week. What resources, aside from guidance, is the state offering them, financial, etc., to reopen and ensure public safety?
We're simply providing guidance, and of course, they can get individualized guidance if they need to with IDPH. But we've basically set out, a set of safety rules for them to follow, as we have for a number of industries. We'll be rolling that out over the next coming days.
Janice in Peoria, from the ABC affiliate there. Many Illinoisans are asking for more recovery information. Can you tell us what you know about recovery data and the challenges involved with trying to collect it?
Maybe Dr. Ezike could answer that for us.
Yeah, so I guess, some of the interaction with the patients kind of falls off once they're not in the hospital. And obviously, there's a good outcome if they haven't, succumbed to the disease. So we can deduce a lot of recovery data in terms of just seeing people who are not in the hospital and obviously subtracting the people who have unfortunately succumbed to the disease. But in terms of actually talking to all the people, it's just been, a challenge for the teams and the staff who are so busy with the response. But we are trying to get as much information for you. We're definitely going to see how we can put that information on the website going forward. We have been very diligent about doing these email surveys followed up with telephone surveys where we were talking to people 14 days after a positive test, 21 days, and 28 days. And we have consistently seen that 70 to 74% of individuals after 28 days following their positive tests have reported that they were fully recovered. So we know that people recover. We know the majority of people recover, but I know that there's going to be some extra satisfaction if Illinoisans actually see raw numbers. And so our team is working hard to get that for the people of Illinois.
John Hansen at WICS in Springfield, what is the number of people who have died from COVID-19 compared to the number of people who have died with COVID-19?
No, that's a wonderful question. And I know that has caused a lot of controversy where people think, well, they had a heart attack and they had heart disease. Why are you calling it COVID? Again, the way this virus works, it is working on multiple fronts, causing multiple manifestations. And so even if someone had heart disease, which we have established, global data has established that there are some key conditions that result in more serious complications. And we've seen that for heart disease, chronic obstructive pulmonary disease. We know that that's a factor. So those cardiac events may have been precipitated by the fact that COVID was involved. We know that COVID-19 infection is associated with causing embolic phenomenon and thrombi. So these clots that are formed in association with COVID can result in strokes, can result in heart attacks. So it's very hard to separate the respiratory illness from some of these other manifestations that also could be linked to COVID. So again, there is a reason to put them together. I know some people feel that it doesn't make sense, but even if someone, I know there was a lot of questions around, well, if somebody was very elderly and they were already maybe in hospice, we still can't say that that COVID infection didn't hasten the death. And so it's probably relevant that definitely that COVID maybe had a chance to accelerate a process. So all of that, whether it's with COVID or directly because of COVID, we have both of those factors lumped together in terms of our COVID deaths.
Okay, Jay Griffin at the Daily Herald. The Illinois Comptroller is reporting more than $240 million has been spent by the state on COVID-related purchases. Can you describe steps taken to ensure the state wasn't taken advantage of and what kind of oversight there is for spending?
Sure. Well, this is something we've been deeply concerned about. We've been in consultation consistently, not only with the Attorney General's office in the state and the state police, but also with federal authorities to make sure that we're following all the protocols that would be necessary to try to prevent fraud against the state. Because as you know, when this first came up in March, I think everybody knew we had to move quickly. We did not have the PPE that was necessary. In fact, almost no state in the United States that I'm aware of had the PPE. And in consultation with many of the other governors, I discovered that, boy, there were a lot of folks out there that were trying to put one over on states and their procurement teams. So we put in place a number of measures. I don't want to talk about what those are, but suffice to say that we have a variety of measures. I guess I'll just give one, which is we asked people to fill out a form to give us a lot of their prior existent information so that we can then go double check and triple check on the veracity of that. So lots of other things that we're doing, but I will tell you that there are definitely a lot of people, fraudsters that are out there in the market trying to take advantage, not just of states and procurement teams, but also of individuals and businesses out there that are just all of us trying to do the right thing. And, in an emergency, in a pandemic, you can imagine the people who are trying to take advantage. They're pretty awful people.
Shia at Politico. Governor, you've talked before about moving towards mail-in ballots for the general election. What about your concerns of getting college students to vote, given that they might not be on campus in November?
That is something that I'm concerned about. And of course, we're going to be sending mail ballots if the General Assembly approves. We'll send mail ballots to the addresses that we have for existing registrations. And so we're going to be working to make sure that colleges forward any mail that comes for any students, inappropriately if the college doesn't happen to have those students on campus. But we also want to encourage students to make sure that their registration is proper in the fall when, before they, the election comes along, so that they have it mailed to the right place.
Daydala WTAX will be our last question online, and then we'll go to Marianne after this answer. Governor, what exactly do you want JCAR to do tomorrow? I'm hearing a couple of concerns about your order lasting, quote, 5 months. Can you clear that up? Thanks.
No, actually, the order is intended, the rule rather, is intended simply to last through the end of this phase, and then we would issue a new emergency rule to fit the next phase, just to be clear. So we're not asking JCAR specifically put in place an Did you hear?
Why don't you give us that answer again, Governor?
Okay, sorry about that if my connection cut out on everybody. But to be clear, we are, the rule that we've put in place, an emergency rule, only would last until the end of this phase, phase 2. That's about 10 more days. And then in phase 3, a new rule would need to be issued. So that's the way it would work. It's not something that would last 5 months.
Okay, Marianne, you're up.
Thank you so much, Governor. Appreciate it. There are still, despite what we're hearing today from you, as well as your medical experts, there are several suburban mayors who are asking you to be more flexible. The mayor of Elmhurst issued another letter today. We're hearing the Naperville Park District is going to file a lawsuit. Of course, Winnebago County says they're going to open up next week. Is it possible that you might be more flexible, because days mean a lot to folks, rather than even waiting until the 29th of May?
Well, to be clear, I am flexible and have been in a variety of ways. What's important here, though, Marianne, is we've got to make sure that we run this full course in this new phase, and literally it's 10 days. So, my view is that the flexibility comes in the way that, at the edges of the variety of businesses that will be reopening, are there more things that they might be able to do? Those are things that are being considered by the industry groups that we put together with advice from the employees, from the owners, from the industry associations, because there's always something at the edge that, as governor, I may not understand about a particular industry, but the experts in the industry do. And so we want to take all of that into account. But those are the changes or the flexibility that can take place. We really do need to stick with the timetable that we have and to follow the metrics. And it's about following those metrics for a period of time. And so we're on track. Everybody should be, I think, optimistic about 10 days from now. Haircuts and manufacturing and offices and warehousing and lots of industries and jobs coming back online. And frankly, I think everybody is pretty excited about it.
From Ben Bradley, a question for Dr. Ezike. Ben Bradley says, they're from WGN. We analyzed the total number of deaths in Illinois for January through April for the last 5 years and found there have been 3,896 more deaths than the average. Given that the state is reporting a little more than 4,000 COVID-related deaths, what does that tell you about the relative accuracy of the COVID count?
So I have looked at that similar data for, I think I looked at 19 and 18 and saw that there were even additional deaths beyond the COVID deaths compared to the previous 2 years. So what's going on with those excess deaths? So that could suggest that there's an undercounting, that we've missed some COVID deaths if you think that we should have had the exact same numbers from the year and the prior year to this year. And so that that's postulating in terms of what we would guess is resulting in the additional deaths that we can't account for. Again, we will not know exactly, but we can just postulate.
From Sarah Schulte, Governor Pritzker from ABC 7. First of all, do you plan to be in Springfield? And can you respond to state GOP lawmakers who say your 5-phase plan with 28-day intervals is extreme? and that you are abusing your executive powers by circumventing the legislative process when it comes to issuing citations to businesses who choose not to follow your plan?
Well, let me start by saying that what's extreme are lawmakers who don't call out their fellow lawmakers who stand at rallies and call, legitimate elected leaders domestic enemies, or give the home address of our U.S. senator and tell people to go surround their home, or the many people who held Nazi symbols at those rallies. That's illegitimate. And frankly, I'm disgusted by the failure of so many people to call that out. Mary Ann, the first half, you had me riled up on the second half. What's the first half of the question?
Sorry, one more time. I believe besides the lawmakers, feel as if they're not having a big enough impact in the citations that you're issuing. The new citation, you're circumventing the legislative process.
The legislative process ran when they passed the Illinois Department of Public Health Act, and that act provides for rules that, if not followed, would result in the potential for a citation or a misdemeanor. And so that's simply, we're following the law that already existed. And I talked about that yesterday.
And also, will you definitely be in Springfield tomorrow?
Oh, yeah, that was the first half of your question. I will be in Springfield, I believe, beginning midday on Thursday. So I won't be there on Wednesday when the legislature calls itself into session. I understand. I think the Senate's calling itself at 2:00 tomorrow afternoon, but I'll be there on Thursday.
All right, thank you. And from Greg Bishop, what should the state do to prepare for any possible lawsuits that could seek damages from the state for businesses ordered closed without due process or just compensation?
I mean, obviously, those are, those lawsuits, people have the right to go to court and sue, but they won't be successful. The law clearly allows us to put in place the orders that we put in. But look, I understand people are filing these suits because they're hurting, and people are hurting all over the state. All of us are being ill affected by COVID-19. And it's not only affected businesses and the hopefully temporary closure of many businesses, sometimes permanent closure, the loss of jobs. I mean, we're seeing it all over the country. There is everything about what we are doing in Illinois that is focused on keeping people safe. And I know that some people don't want to hear that anymore. Some people don't want to hear anymore that this is about keeping people safe, but it is. And we're doing everything we can to open up the economy and do it safely. And you've seen a full plan. In fact, many have called it the most comprehensive plan for opening a state. I mean, we've been very explicit about how and what the metrics are that we're looking for. And again, I will aggressively pursue reopening, but not at the expense of people's health or safety.
From Jim Williams at CBS2, we're hearing from people who left a job because they accepted new employment with another company, only to have the new job rescinded when the pandemic hit. Now they can't get unemployment benefits because state records show they quit a job. What can be done to fix that glitch in the system?
Yeah, well, we'll certainly look into that. I understand what the challenge is, and I appreciate you bringing it to our attention. It's something we want to make sure and look into. And I want to correct something that I said a little bit earlier. I'm actually leaving tomorrow to go to Springfield, so just so you know. But I had originally intended to leave Thursday, but was reminded that I'm leaving tomorrow.
Okay, no problem. Let me see. Another question here from Eric Hung from ABC7. I understand the governor, you talked about the regional metrics. According to the IDPH website, hospital admissions in the Northeast region have fallen more than 30% since May 1. The other regions are seeing even steeper declines in hospitalizations. Is this not evidence that we have fallen from a peak?
I am optimistic that we are falling from a peak. However, I want to point out that if you look at all the metrics, I mean, they're not all, headed straight down. Some of them have sort of flattened. They're floating a little bit off their peak. I mean, I'd rather Dr. Ezike gave her view to add on top of mine, but I'll just say I am optimistic. There's no doubt about it. Every day I watch those numbers like everybody else does, and we keep them in chart form. You can find it online in chart form, and you can see the line gradually heading in the right direction. So it feels good. It's the right direction, but be clear that when you're looking at these metrics, a lot of them are affected by things that have happened days ago, weeks ago. And so as you watch them, what you're really seeing is a reflection of something that happened, an infection perhaps that took place 2 weeks ago. And so that's why it's hard to project forward when you look at a hospitalization number. But it is the best number, in my opinion. ICUs and med-surg bed numbers are the best numbers for us to keep an eye on, in addition to obviously the positivity rate and capacity.
All right. Did Dr. Ezike want to weigh in as well about the peak?
Sure. So we want to say, we kept saying for the last weeks that we thought we were plateauing, that we were flattening, and that eventually we were hoping to be on the other end, actually going down. We're hoping that the data is showing that is where we're going. I will highlight the fact that when people complain that we're not moving fast enough with the plan, let's remember that we advanced ourselves into phase 2 while we were flat. We clearly weren't going down then. So we jumped ahead in getting into a new phase before the actual heading down. We may be heading downward now, again, as with more and more days behind us, we can follow and see, is this a blip, or does it look like it's really consistently going down? In any case, that's great. We're hoping that we are there. But please remember that we did start some of our progression into these advanced phases, into phase 2, while we were still flat as opposed to going down. But hopefully now we're going down, and we're following those numbers ever so closely, and so that we can see if that's the case. Remember that there are multiple metrics, and the data doesn't follow rules and stay straight for a day, then go down for 20 days and continue. So, one metric might go up and down, another metric may stay flat. So we're following all of it, trying to make sense of it. We definitely want to see that we are heading down on the downward side, and we are going to know in a few more days to weeks if that really is the case.
Dr.
This will be your last question, so we can get through it.
Wait, I got 2. Just really quick, physicians are claiming that more than 15,000 meat plant workers in the U.S. are infected with COVID-19, and at least 60 have died. With workers lined up in close proximity, viruses are easily spread within the slaughterhouse environment. Do you believe that these plants need to be shut down?
I think as we think through all the different ways of reopening our state, when we really put our minds together and try to think of ways to be safe, there are ways to safely do a lot of things that we think we, initially maybe thought we couldn't do. But with all the awareness of the importance of social distancing, with masking becoming something that we accept now, the face covering, the mask, with people understanding the importance of hand sanitizer and how it needs to be put out everywhere, and understanding. I've seen plans where businesses have said, yes, we plan to have something sanitized, the touch screen or a surface cleaned after every use, after every hour. All these different mitigation measures are what is going to make it possible for us to open things that maybe 2 months ago, when we were very new to this whole process, that we couldn't fathom doing. So we are working with our infectious disease experts, with epidemiologists, with business industry experts, all of those people, to put the best minds together and the people who have the most knowledge of the industry to come up with plans that will keep people safe. Of course, as Dr. Landon is always expressing, a lot of onus is on individuals. It's not just the people who are making policy, writing policy. It's actually what is written then has to be implemented, and the implementation involves people. It involves the managers of these industry. It involves the individuals who work in that industry. Everybody has a part to play, and if everybody plays that part, the right way, we can open many businesses safely.
Thank you. And then my last question, Governor, and this is from Elizabeth Matthews as well as myself. I had this one written down. We talked yesterday about your blind trust, but there are companies within the Pritzker group, one of them being Path Group, that has a contract with the state for testing. Even though you're in a blind trust, are you still making money from it in the long term? That money will be there for you after your governorship, correct? Is it ethical for it still to have a contract with the state? Should you have, whether it's coronavirus or not, for any Pritzker company to profit in any way from a state contract?
Well, as you know, the very definition of a blind trust is that it's blind. So, I, as you know, stepped away from all of our businesses 3 years ago. And everything is in a blind trust. I've business or decisions that have been made at any of those businesses. So, really uninvolved for 3 years. So if there's anything like that, I would not know about it.
All right, Rick, you're up.
Governor, yesterday you said that you saw no need for lawmakers to review your orders, but the legislature is a co-equal branch of government, and isn't it fair for them to provide their review of the orders or the reopen plan as the people's representatives?
Well, I was asked if I needed or wanted the legislature to ratify the orders that we put in place. That's what I was asked about, and that's what I responded to.
So should legislators, review as part of their purview what you've put forth?
They're a co-equal branch, as they often like to say, and certainly have the right to do whatever they'd like in this regard. But I'll just say that I haven't asked for any specific review.
I'd also like to know, back to this emergency rule, and obviously lots of blowback on this. And you said this is a lighter punishment than lifting a business license or a shutdown order. But isn't there an alternative to injecting an arrest element into this?
It's not intended to inject an arrest element. And I think you would hear, state police and other law enforcement tell you that this is simply a citation that can be issued and a decision at the local level about whether a business is in fact, really endangering people in their community by refusing to close when they should, according to the orders that are in place. So that's the purpose of it. It's really intended to be a lighter version of, a kind of enforcement mechanism rather than taking away somebody's liquor license or shutting the business down entirely.
Greg Hines at Cranes asked if you would respond to a Moody's report out today that the city and the state actually face greater pension risk today than they did in the subprime recession. Are you committed to making the full statutory contribution this year, or do you have any plans, to speed up any payments?
No, I'm committed to making the statutory required payment to the plan, and I would love to be able to speed up more. As you know, I proposed doing that in the budget that I proposed back in February, and would like very much to be able to do that for the state. But as you've seen, we've got a pretty big challenge ahead of us to balance the budget, and I know that the legislature is working on that even as we speak.
Joshua Vincent at the Clinton Herald and WHBF in the Quad Cities. Governor, with more and more local law enforcement officials across the state and here in northwestern Illinois saying either they cannot enforce your orders because they don't have the manpower or because they themselves don't agree with them, are you getting to the point of just giving up on the idea that your plan, though it may be good in intent, just isn't working for the rest of the state that's not Chicagoland?
Well, I'll just remind you that the vast majority of the people of the state are in fact following the plans that we put out, and the vast majority support the plans that we put out. They are supportive of the stay-at-home rule and supportive of the work that we're doing to fight COVID-19. So I know there are some vocal, leaders across the state, mayors or sometimes law enforcement who work for mayors who speak out. But look, I think everybody understands that the enemy here, the fight that we're in, is against COVID-19, and that we ought to be following the science and not just the whims of desire by a mayor here or there, or or a leader of a reopen group, especially those that are carrying vile signs to make their point. I think instead we ought to be listening to level heads. There are three of them on the line here today, three doctors who live and breathe this every day. I mean, they have to work and understand COVID-19, and they've given you their views, and it's why I brought them forward. I could bring you dozens and dozens of others. These happen to be three of the great leaders in the state of Illinois, giving you the message that we need to stay the course.
Jim Leach from WMAY in Springfield has a question for Dr. Ezike. You've said that the state is reviewing COVID-19 deaths and removing those where the virus is not seen as a contributing factor to the death, such as homicide or car accident. How many such deaths have been identified and removed from the state rolls so far?
That is a small number, less than a few percent. We can get that information, but that is not a large number of our unfortunate large total number of deaths.
Governor, yesterday the Republican leaders held a press conference, and House Republican leader Jim Durkin basically, along with the Senate President Bill Brady, were saying that in light of the circumstances that people are facing in the private sector, that there are questions about why isn't state government laying off people? Why aren't state workers taking pay cuts?
Well, there are two things to keep in mind, and I know that they want to cut state government no matter what, whether COVID-19 is here or not. But here we are in a pandemic, in an emergency, and it's now more than ever that we need to stand up for the social services that people need, to make sure that we can fund the programs that help them reduce their rent. This is exactly the time when you don't want to cut public health departments, when you don't want to cut back on our emergency management or on our Department of Innovation Technology. These are all things that now in the pandemic, in the emergency, you can see that state government should be doing. And in fact, we're going to have to do more because so many people have been financially damaged by this disease, by this infection. And so I would just suggest to them that the thing that we're looking at as we think about balancing the budget is the federal government going to step up for all of the states? We're not asking for anything special in Illinois. All of the states, Republican-led states and Democratic-led states, have the same issue. We had a fall off of revenues as a result of COVID-19, whether you're talking about Florida or you're talking about Georgia or you're talking about California, New York, or Illinois. And so they should at least acknowledge that their first, instinct to cut everything is wrong here. That what we ought to ask is, what do we need to preserve in state? What do we need to preserve in state government in order to provide supports for people all across the state?
WBBM News Radio. Governor, some businesses in the Chicago area say they're starting to see a handful of customers attempt to come in without masks on. And when asked to leave, they say that they have a medical condition which prevents them from wearing a mask, that they must be accommodated under the Americans with Disabilities Act, and that under HIPAA, the store cannot legally ask them about their condition. Have you heard about that? Is it legal? And how should a business react when confronted with something like that?
It's a good question. And it's, as you can imagine, this is something new to America. And now that we have a face covering requirement new to Illinois, our Department of Human Rights is in fact responding to this and providing guidance for people who need to go into a store who can't wear, for medical reasons, can't wear a face covering. Look, what we want here is for the most number of people to be wearing face coverings. It's not about requiring that every last person, especially somebody that's medically unable to wear a face covering. But most people, if almost everybody would wear a face covering when they go out in a public place with other people and can't social distance, that will do so much to reduce the spread here. So we'll be looking into whether there are federal protections and how we can enact that. But for now, anyway, the Department of Human Rights is providing guidance for businesses as well as for individuals.
Kelly Bauer at Block Club Chicago. Why is the state not doing widespread testing of residents at all nursing homes with known outbreaks? How does it determine which nursing homes get to test residents?
Well, I'll turn this over to Dr. Ezike in a moment, but just to say, we are in fact going after widespread testing among our nursing homes and even among residents at places that have outbreaks. But as you know, as we've been ramping up testing, there's been a limit to the amount of testing that's available. As we ramp it up even more, we'll be able to do even more testing. But we've had a focus on nursing homes, and I'll let Dr. Ezike give you the update on that.
Yeah, so just to follow up on what Governor said, our goal is to test everyone in every nursing home. The only reason that we don't do that now is because of the limit of our supplies and our capacity. But as we're aggressively working, again, going from a few hundred to 5,000, now we've averaged 20,000 for the last about a week. So as we increase our capacity, we're increase the testing. We absolutely want to test. We were probably one of the first states in the nation to go in and start testing an entire facility back in March, but it wasn't sustainable because of the supplies. But that is our goal right now. Some of the criteria that we are using, because we do have many facilities around the country, so it's even just an issue of getting into all the facilities. But we do try to identify areas that already have a high burden of disease, hot spots, if you will. So we use that as one of the criteria as a place to go into. We also identify places where there's an acute spike in that area. So that an acute increase in an area is another reason that would make us to identify a long-term care facility in that region. And thirdly, we look at if there is a high social vulnerability index. So social vulnerability index, that's a CDC metric, if you will, that takes into account basically the higher your social vulnerability index, it's scored from 0 to 1. The higher it is, the closer it is to 1. That means that area, that census tract has a high rate, high number of individuals who are more susceptible to having bad things happen in association with this virus. So if there are more impoverished people, if there are more uneducated people, if there are more people without insurance, if there are more people without jobs, we know that that any kind of disaster, a public health emergency of this kind, will ravage that area more so than a community where everyone has insurance, everyone's educated, everyone has a job, everyone has transportation, etc. And so we're using those three pieces to prioritize the areas that we go in first. But please know, if we had warehouses and warehouses full of all the supplies and we had all the capacity to do 1 million tests per second, we would hit every nursing home, and we'd hit them repeatedly, not just once, but we would be doing it with a consistent cadence to keep testing and retesting. And that's what we hope to get to.
A related question is that, and obviously knowing the issue of the coronavirus in nursing home and these kind of settings, at what point do you think people will be able to visit family in nursing homes? Are there any plans for testing or socially distant visits to help this happen before a vaccine is established?
Yeah, that's a great question. And I will tell you that there has just been federal guidance that has been put out on this issue. And it says that visitation should be one of the last things that we should be thinking about, because this group is still so vulnerable and because there's still not an effective cure or a vaccine. I mean, put it in this is a global problem. If you look at Canada, 80% of their deaths have been related to nursing home residents. If you take all of Europe, over 50% of their deaths, again, in the same population. So this is a global challenge. And so visitation and having more people come in with the virus back and forth into this setting is not the solution. And the federal guidelines have said that just recently. They said we should be very slow about thinking, even as people cycle into their new phases. Visitation should be way down on the list. When we've had places that have had an outbreak, we need to go in and do a complete survey of the facility before we think about lifting visitation restrictions. So visitation is not the way we're headed now, but we do want to, encourage, a more virtual visits. People, we don't want people to be socially isolated in terms of their connection to their loved ones. So however people can promote that, whether it's through iPads or Zoom and WebEx, we've gotten really good with virtual connection over these last 2 months that we've been dealing with the pandemic and staying at home. And we want that to be available to our nursing home residents to try to, take some of the sting off the fact that their loved ones can't come in person. So no, visitation is not something that we're rushing to do, but we do want to promote connection, virtual connections in every possible way.
All right, that's all we have time for today. Thank you everyone for joining us. We'll see you again tomorrow, hopefully not virtually anymore.